Today we're going to focus on leggies underneath the knee, our ankles, and our feet. We're going to kind of like combine this into like reflexology and a more like therapeutic medical approach to the legs. Basically, why I'm doing that is because in the state of New Jersey, you don't need a license to do reflexology. And basically, reflexology is just massage on the foot, ankles, and lower legs. It also, in the state of New Jersey, includes the hands, and it also includes the ears. So you could really bring it up and do like a whole treatment. But when people say reflexology, they're thinking foot massage. That is what like the general population is thinking. It's a synonymous like foot massage equals reflexology. I think the history of reflexology, correct me, I will be wrong about this, is that like some dude in the 1960s was like, oh, hey, your organs correlate to spots on your feet. And then he made a map. And now we widely use that map to stimulate those organs that correlate with the map on the foot. I think that there has been science to debunk this, so it doesn't actually like hold up in court. If using a figure of speech, there's been studies that have that don't really back the explanation of reflexology up. So I'm not really concerned about you knowing the map of reflexology, because most people don't even know it anyway. We're gonna go over it very, very quickly and roughly, but then we're gonna move into like the more therapeutic stuff of the foot. I got what is this? A blind handle? What do you call this? What's the name? Blind handle. Okay, so even though this is split up into three different things, pelvis, sciatic nerve, pelvis, in my mind, I just kind of see the heel as like the lower pelvis region. I totally forgot about the appendix point being over here. This is, I'm just remembering this now. I am concerned about the small intestines, and I'm really concerned about this right here. If you follow this, so if you kind of like break it up into the like this C, if you follow this C from like where pop off the heel and then follow this C up to where the toes kind of begin, you're going to catch a lot of stuff. So if you forget that bladder starts here, the small intestines is here, the ascending colon is here, but you follow this line, you're going to hit all of that. And then when you follow it up, you end up hitting the gallbladder, you hit the liver, you hit the adrenal glands, and you hit the kidneys. So do I remember any of that? Nope, I don't. But I do follow this C line because this C line gets me to where I need to be, and I know I'm hitting all the things that I need to hit. And I think I need to say this too. I just like started this whole thing by saying like, is reflexology legit? Probably not. There's no science to really back it up, but there is such thing as like placebo effect. Yeah. If somebody believes it, it's going to help them. So if somebody comes in here saying, I want reflexology, it's helped me in the past, even though I don't believe it necessarily, I don't agree with it myself personally, I will still follow this map because I'm respecting what they believe. And if they believe it's going to help them, then I'm going to give them what they're asking for. So I don't really remember these places, but it's okay. I'm just going to follow this line. Then I get up into where the toes are. I know to follow. I don't remember that this is the diaphragm, but I do remember to follow that line right before the joint of the toes start. I know that all of this right at the like padding of the toes is the lungs. I don't remember that this was thymus and heart, but I do know that two things are over there. And then we come up here into like more of like the head stuff, making sure that I touch on the toes. I know these two big points, the pituitary point and the solar plexus, and that's the map in my head. Like that's what I am remembering and following. So do I remember this breakdown? No, but I do know that the heel is the pelvis region. Do I know this entire middle breakdown? No, I do not. But I know that if I follow the C, I will hit all of the organs that are aligned in this middle ground. Do I remember everything that is in the toe padding? No, I do not, but I do know that if I spend time here, I'll hit the respiratory stuff. And if I spend time here, there's two important things over here that I don't remember, but it's okay. And if I spend time here, I'm going to spend time in like the head region. So generalized map, this is what we're following. If we bring it over to our feet, so if I'm following this map, I'm going to press into the heel part. I could do a couple passes. I'm going to pay attention to where the heel like ends and the flat of the foot begins, and I'm going to press in a line. It doesn't matter if I go lateral or medial, but I'm going to press in a line going that way. When I get to my C, the arch of the foot, the flat of the foot, deals with like internal organs and like digestion stuff. And it goes like the intestines do. So like it starts here and does the C this way. Sorry. It comes up before the toe, the bed of the toes begin. And then it continues on this foot and comes this way. So when we're following the basically, so when we're following that path, if you're starting on this foot, you're actually starting here and following it this way. Because we're stimulating the same path that the digestive organs, the intestines take. So if I'm starting on this foot, I'm starting up here, and I'm usually using my thumbs and I'm pressing. Or if I have lotion on, then I am doing some like I'm pressing in and doing a glide, and I'm following this C. So I'm going up here, going here, going here. I'm right before the lateral part of the foot, but I'm not directly in the middle of the foot. And then I come down here where before the heel begins, and then I bring it over into here. Usually I do 1 foot at a time, so I would not go hop over here and then continue this. I would just carry on. I'm going to come up to the plexus, that solar plexus right in the middle. That is before the toe bed, right in the middle, and you're just gonna put like a big, like just push into it. If I'm going to spend static time anywhere, it's going to be here in the solar plexus, because I might not believe that heavily in like the Eastern medicine or energy chi thought process, but I'm going to respect it because it does exist, and it existed for so long, so there must be some kind of merit for it. So I am going to hang out in the solar plexus, especially if I'm just in like a regular massage and someone's just complaining in general about being like down, not having a lot of energy, just being really tired in general. I might just hang out here and just apply pressure in the solar plexus and just chill. Also, and this is a step above, but this is where the toe muscles are originating down here. So if I get the toes involved, now I'm creating this like pin and stretch type of thing, and it is kind of like unvelcroing layers of fascia and muscle. So if I feel tightness, I could just statically like push in and hold. Sorry, buddy. But if I want to spice it up, I can stretch my toes backwards, and I can even then, like, once I feel like I spent enough time on the solar plexus, I can follow the line right underneath the toe pad and continue with those toe stretches. I can get another line or another spot, do the toe stretch, go to another spot, do the toe stretch again. And then I'm coming up here into the toe pad where it's synonymous for me for like respiratory. Thank you. And then we bring it up into the toes, and we can we just press into each toe, like the toe, the pad of it itself. I like to be spicy, and I like to squeeze the lateral part of the toes as well. because that feels good. And if they like it, we can also pull on the toes. Jenny doesn't like her toes pulled, but Marcos, how do you like your toes pulled?
Right.
So that's like your basic map that you're following, right? And then we can go to the other foot, and then we can start the process again. So that's your basic reflexology map. If someone's like, I want reflexology, I'm so into it, that's the map that I'm going to give them. If someone wants reflexology because their foot is really bothering them and their ankles are sore and they need a really good foot massage, I'm not going to follow that map. Instead, I'm going to make it a little bit more therapeutic, right? When people say, ouch, my foot hurts, I'm interested where they're feeling the pain. Is it at the top of the foot? Is it at the bottom of the foot? Is it more in the heel? Is it more in the toe bed? Is it in the toes? And they'll point us in the right direction and all. But the feet don't just start in the feet. Like, they're not just in the feet, but they start in the lower legs. So when we work the foot, we can't just work the foot. We have to bring it into the lower leg. So I want us to be really hyper aware of these muscles. So we have this guy, peroneal muscle or digitorum longus, or extensor digitorum longus or peroneal longus. We also have peroneal brevis too. Peroneal longus and brevis are going hand in hand together. So before we talk about tibialis anterior, and we need to know that the peroneal is starting up here. So we need to understand that this is starting on the bone right underneath the kneecap, and then it is coming down and landing on the lateral side of the front side of the ankle, and then it is the on top of the foot toes muscles. This is the muscle that's controlling the toes to go, yes, dorsiflexion. And then we have our tibialis anterior, and we have to understand that this guy is originating in the same spot that peroneal or digitorum, whatever you want to call them, are originating. But then this guy is crossing the lower leg. So our tibialis anterior is starting off in like towards the knee, and then it's crossing the lower leg near the ankle, and then it's not going around the ankle, but it is going around the foot and catching the foot at the bottom of the foot. We call this a stirrup muscle because it is also responsible for that dorsiflexion, for bringing it up. So that spot, if I can get it again, right there where it is hitting that lateral side of the foot, that is so important to us. Anytime anybody complains about foot problems, aches in the arch of the foot, or plantar fasciitis, this is one of our culprits that is either causing a problem or we just have to get him to calm the F down. If this is here, it's going to be like right around here. So I'm finding this bony landmark, and then there's another talus that starts in the middle here somewhere, and he's kind of hanging out on the side where he's starting. I don't know exactly. Oh, it feels actually right here. And as I was like pushing my hands in, I just there was nothing here, but then I felt this tautness right here. So if I press in here, I know I'm in the right spot. This is where he's attaching in, and he's responsible for doing this, right? So I can work with him by pressing in and making him do that motion, or I could bring him into the opposite motion and bring him into inversion and like that. So honestly, sometimes if I get confused about how movement works, I will just do both of them until it feels right in my hands. Okay, so peroneals are important because they're attaching here, coming down and attaching into the feet. Tibialis anterior, super important. He's coming down, crossing over this little spot, and then coming up in here. He's a stirrup muscle. Oh my God, was I lying the whole time? So up because the digitorum is its own thing. It's not the peroneals as well. And I knew this, but I'm psyching myself out. the digitorum is starting here and it's coming down here and it's doing the E version of the foot. But the peroneals are another thing too that's also starting over here, but they are crossing underneath the ankles.
Like this cross up.
And then they're coming out and being a stirrup on the foot as well. So you have your, and that's where I'm confused. Okay, so I found them. So those are our three things. I'm not so concerned about the digitorum unless people are complaining about eversion. I'm concerned about tibialis anterior because he's coming down, crossing over this guy, and then stirruping here, and he's responsible for this. And the peroneals are also starting over here, coming down, going around the back of the ankle, and then attaching in here. And both of them are stirring up, like they're stirrups to catch the foot and do this.
Good.
So when people are complaining about feet, I'm thinking of these two muscles in particular, like on high alert, and I'm following them down. Notice how there's nothing over here, right? Okay, so if I pull up a whole anatomical figure, we can see the muscle on the front part of the shin. And we can see the muscles on the lateral part of the shin. And we can see the muscles on the posterior part of the calf.
The gastroc.
The gastrocs and the soleus. But if we come over here to the medial part of the shin, there's nothing over there, right? So when we're working, there's really no reason for us to be in the medial part of the leg. If someone's like a runner or if they use their legs a lot, I might come in here next to the bone and I might separate the back of the soleus and gastroc away from the bone a little bit. But for my generalized person, I'm not wasting my time doing this because they're not using their legs like a runner is. So I'm not wasting my time doing this. I'm going to waste more of my time here because this is where the belly of the muscles are. And if people are complaining about leg problems or feet problems, I'm starting here in the peroneals and the tibialis anterior. Okay, so yeah, do you want another leg? So when I start my foot, I'm gonna kind of wherever the ankle the ankle joint is meeting the shin, I'm gonna kind of shove my thumb in. I'm doing it right next to where the shin bone is, and I need more foil for my life. And I'm just kind of like muscle stripping up next to the bone, trying to separate like tissue away from the bone. Yeah. I'm right next to the bone, on the lateral side, right here. Yeah, because again, there's really nothing over here. The only thing that's over here is right here when the tibialis anterior is crossing over. And it's coming up here. But I'm not really concerning myself with that necessarily. I'm concerning myself more with the bellies that are going on this lateral side. So I'm with if this is his middle, where my middle hand is is applying the pressure, and because I'm muscle stripping, I'm going slow because muscle stripping can hurt. And he's not really warmed up. We're kind of warming him up, so this muscle stripping is kind of a little bit of a warm up.
Come in.
I can come. So I know. I love you so much. You're gonna kill yourself. I'm gonna preserve your energy. When we do a lot of this kind of stuff, we're going to get tired and we're going to get overworked. And then 5 hours in a day seems really, really daunting, right? So if we do a lot of this flowy kind of movement, that's your typical Swedish session, right? But it's going to tire you out so much. So just follow me. Okay, so we're stripping. We're going slow because we have to go slow with a strip. It can kind of suck for some people. We can come back and we can do it again with the same hands, or we can switch hands if our hand got tired. I don't feel like I want to switch my hands. I like this. We're muscle stripping, but we're not going super duper deep because he's not warmed up for it just yet. But the strip itself is warming up. And because I keep like coming back and doing it a third time, that, like, every time I do it, I can get just a little bit more. And every time I do it, I'm going to not do the same line, but I'm just going to go like maybe a half an inch, a quarter of an inch over, so I can get the next degree of muscles. I'm sorry, buddy.
Who's like the boss?
I can't. I feel the guard. Yeah, okay, shake your head. It's fine. And then when I get up to the knee, I might statically hold that for a second, just because this is a tendony spot where the muscles are kind of like originating into. So I might just like hold it for a second. And what is happening is really like the pressure in my thumb. That's the rock star right now. So like this is holding. My thumb is right here. So as I keep going kind of like up and up, I'm just kind of going, over a degree, over a degree, over a degree. At some points, I might swing my chair around and so that I can work the more lateral side of this leg, because what ends up happening is like there's like muscles here, and then there's like a muscle that comes in over this way. But what I'm trying to do is like I was separating these immediate lateral tissues away from the bone, and then as I get my degrees over, I can feel another muscle kind of like butting up against these lateral guys. Do you feel like here, right here? Do you other muscle like overlapping? Yeah. Not overlapping, but like coming in. Oops, sorry. So like you have these guys, and we're stripping up. And notice how like you're using my two fingers. So like you have options, right? You can, whatever works better for you.
You doubt yourself. You're sexy range.
As I go over my degrees, there is this, I can feel something else coming in. So like you feel that right here.
Yep. Yeah.
So like there's this. Then there's like this more twingy guy. He's like a guitar string. So you feel how like right here, it's spongy. Now go a little bit laterally, and then you can feel that twangy tissue, right?
Not really.
Okay. No, it's okay. You're right on. Yeah, right here. Like press in right here.
Okay.
You feel, okay. So yeah, notice the twanginess of that soft tissue feel. But next to it, closer twang to guitar string. Oh. The guitar string is so taut that you can twang it and it goes twang, right? Okay, so muscles that are twangy like a guitar string are not necessarily the healthiest muscles. So we're looking for twangy guitar string muscles to fuck with in the most therapeutic way possible. So if I'm in here, it's squishy, right? Like it feels okay. But when I start coming over, I get into like this guy, he's I don't know who he is, but he's going this way. And if I go this way, if I cross fiber friction him, I can twang him. So if I feel that twanginess, I'm going to hang out there a little bit. So I did my strips up, down. I start getting more laterally as I go in. When I feel that twanginess, now I'm going to do cross fiber friction on him. And I'm going to apply pressure as I'm cross fiber frictioning this. You can't see. You're not allowed to look. I'm kidding, Marcos. And I'm going to follow this twangy muscle up. I'm cross fiber frictioning him. I twang, and then I bring myself up a degree. I cross fiber friction him, I twang, and I go up a degree. I cross fiber friction him, I twang, and I go up a degree. And I follow it until I get to here where those muscles are originating out of the bone. Okay?
Cross fiber.
Yeah. So, So I'm literally just like, so if the muscle is going this way, I'm pushing like that. And then I'm going up a degree. I'm pushing. I could push once, or I could push twice or three times, depending on how I'm vibing with the tissue. And then I go up a degree.
Feel the twang.
I want to feel the twang. Okay. It's not going to do anything for them if they don't feel me twanging on them. Put that on a fucking t-shirt. So what I'm doing, like this process in my head is that I am muscle stripping to find stuff. While I'm finding stuff, I'm also warming tissue up. I'm not going super deep because he's not so warm just yet, but I'm still going with like some kind of moderate pressure because I'm looking for stuff. I go up this is the first like degree of muscles that I went up. So I come back and I just go over one little degree into a land that I wasn't like, I don't want to do the same path. I want to just go over a little bit. And then I'm going to, with the same pressure, that medium-ish pressure, I'm going to go up and strip this. And again, it doesn't feel twangy to me. So I'm going to leave all of this. But when I start to get up here, I can feel tension right here. And I'm going to follow this up to where the origin site of the muscle is, just because I want it to feel complete. But then I'm going to go back to this spot that I felt twanginess in, and I'm going to cross fiber friction it. And then I'm going to go up. I'm going to cross fiber friction it, and then I'm going to go up. I'm going to cross fiber friction it, and then I'm going to go up. I'm going to cross fiber friction it, and then I'm going to go up until I finally get to where the origin site is.
What are you doing when you say cross fiber friction?
So the muscles are going this way.
Yeah.
So I'm going this way.
Okay.
So if the so muscle stripping is going in the direction that the muscle's going. Cross fiber friction is going in the perpendicular way that the muscles are going. Yeah. Okay. So perpendicular. So muscle stripping is straight. Cross fiber friction is perpendicular. I want to do cross fiber friction when I feel really tight, taut places, or if there's like a trigger point. I'm gonna like statically hold it, as is the trigger point therapy modality. But then I'm also gonna throw some cross fiber friction in there as well. Cross fiber friction is one of your biggest tools in your toolbox when it comes to medical therapeutic work. Okay, so I go up, I cross fiber friction in this area where these two these places, this is really taut, and I can't think of the structure names. I'm so sorry. But I'm going to hang out here a little bit because of how taut this area is. And then I might even bring it to where the gastroc is meeting up with the supine muscles. So like I might bring it here, and I might do a muscle strip to kind of like separate the gastroc from these guys. And then once I do that, I'm going to then, I don't know, I'm transitioning. So usually into the ankle foot. When I transition, I usually, hello, come with me. I usually do a traction. Yeah, can you pull them back a little bit? I do a traction. I traction almost every time. Like if I'm flowing this way, I'll traction it because I want to, I don't know, it just feels great for them. It does, yeah. And everyone likes being pulled like they're on a medieval stretcher. When I follow this back, I'm going to follow the ankles. Why?
Because then.
She's like, don't put me on the spot. I'm following the ankles because the peroneal muscle goes around the ankle, so on the lateral side. So I'm following the peroneals are turning into ligaments as they go around the ankle. So I'm following that. And is there something over here? I don't know, because the anterior, the tibialis anterior crosses this way, so it's not going around the ankle. But I still am going to touch on this while I'm touching on this guy. But I'm mentally touching on this right now because I am touching on the peroneal muscles. And then I'm going to follow these stirrups until I get to where they're attaching into. Now, anterior, tibialis anterior is attaching around here, but I'm just going to do like a bilateral movement type of thing. So I'm shoving my one thumb here and my other thumb here, right where the here and here, right where the heel is kind of meeting the arch, or the flat where this is starting. I'm trying to get my fingers where it's starting to begin. So one on the more medial side and one on the more lateral side. Like here. Bring this thumb this way. Yeah. And then a nice big pressure push in. I can statically hold this. And And then I can even get them involved. Can you bring your... So when I'm dealing with customers, I don't tell them how to do things in medical terms, or like I won't say evert your foot, because half of the time my clients don't know what that means. So I'm gonna say, can you bring your foot? Can you flex your foot towards you? And now I can get him engaging with those muscles that I am currently statically holding. Now point your toes to me a little bit more. Great, this is right. So like I can ask him go back to neutral. And then so then going back to my reflexology mat, remember that I can press on my heel and stimulate the pelvis region a little bit. If this person is pregnant, I'm not going to stimulate the pelvis region that much. And remember when I said we're going to follow the ankle path for the peroneal muscle, not in a pregnant lady, right? So all of this is not happening with a pregnant lady. But anybody that is pregnant, well, yeah, fair game. And then, okay, so if someone has plantar fasciitis, I'm going to spend a lot of time right here where the arch of the foot is beginning, because that's usually where a lot of people are complaining. So if somebody's complaining about plantar fasciitis, I'm going to spend more time in this region and doing a lot of like pressure holds. If I push my thumb in, I'm going to play with the movement of the foot, right? Because you can feel that stretch when like push or press in with your thumb, and then you can flex the foot. You can kind of evert the foot a little bit. You can invert the foot a little bit. And then I can change my holds and go from this spot to this spot, and then do the same movements again where I'm flexing the foot. I can evert the foot. I can invert the foot. But he's getting, we're going through movements so that the body understands, like, what is the body understanding? I don't know, that this movement is now safe. And then I can go over again to another spot on that line and flex, invert, evert, all that good stuff. Then when I get up to this area, or at least like the flat of the foot, subconsciously I always follow that C. Because I don't, like I said in the beginning of this, I don't know how much stock is behind reflexology, but if it is true, I'm right, I'm following it somehow. I'm going to pressure point in, do the C around the flat of the foot right before the start of the toe pads. I don't want to go up there just yet, but I am going to follow this up. Once I get like to where that big toe, like this joint, it's tense and tight in here, right? Do you feel it? Like right here. I feel this tension right here. So I'm going to park my thumb here, make a static hold, and I'm gonna now play with the toes. Essentially, I'm using my toes to evert, invert, flex, just so I can stretch these muscles out a little bit. When I do it when I go through the motions for one spot, I'm going to move over a degree a little bit and do it again in another spot. And I'm just going to follow this whole thumb until I feel like this little toe joint can be a little bit freed up and away from his compadres. Because realistically, us humans should be able to lift our big toe up without our little toes going up, and we should be able to plant our big toe and lift our little toes up without, and most of us can't do that. I can't. We should be. I can't. We should be able to isolate that, and most of us can't. Are you trying?
I got it.
You're doing it with your big toe. Can you put your big toe down and then isolate your smaller toes without your big toe? Okay. So that's something that's really important to humans that a lot of us have lost. Because of shoes, because we're not walking enough, because, X, Y, and Z reason. So when I'm in the foot, I'm going to kind of like try to recreate that. So I just, I pin down all of these ligaments around the big toe so I can kind of get the big toe a little bit free. And then I can do the same thing where like I'm pinning down the little toes, and then I can do some big toe movements, or just pin down the big toe and then stretch these guys out without the big toe being involved. Yeah, so I'm just hulking him down, and then I can play with these toes separately. And then I can give him homework at the end of this session, being like, you need to do some toe yoga, my dude. Like, you need to isolate your big toe from your little toes. You need to do this exercise, like, at least in the morning and at night, where you're just boop, 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 boop. Okay, so we got up here. We're working with the respiratory system. We got distracted with big toe because he's a little on the stuck side. Then we isolated the little toes too. We can go into the toe pads and do little pressure points in here because it feels nice and we're stimulating the lungs and stuff. We get to the toes. Depending on your session, you might not have a lot of time, but if you do have time, we take up time with toe work. Squeezing the pads of the toes feels amazing. Squeezing the lateral side of the toe, so like this, is going to give a different, no, it's me. I'm the one who has Hulk hands. But I like to give different tastes of what's going on so that they connect with their body a little bit better. So I'm going to squeeze the toe this way and the toe laterally to give both sensations. If they're up for it, I can do a little toe pull as well. Some people might not like it. Some people will love it. When I feel pretty okay with the toes, I'm going to come in and start working the top part of the foot a little bit, because we know that that digitorum muscle that started up here came down here, branched off, and he has little offshoots of ligaments to each of these guys. So I'm going to, I can do a muscle strip, a glide in between the webbing.
Not directly on.
Yeah, because, I don't know, like they're ligaments, so like they don't really respond the same way as like the muscle bellies do, but there is fascia that's like keeping all of this together. So I'm gonna do like a muscle strip, but not so heavy, because this is also a sensitive area too, just to kind of like get that fascia to be more gel-like instead of like solid. And then it's just like repeat it based on what you felt in the initial. Yeah. So like we did all of this work, but that doesn't necessarily mean that we're done. We did, like, all of this was therapeutic and good in some sort of way, but as we go along, we're going to notice some areas that might need a little bit more love. And that's how we figure it out while we're in session. So I noticed that this was really tight, and we were going to need, like, this could, if we have more time, this could definitely need use a little bit of work. He complained about having tendinitis here. So right in your heel. So we can spend a little bit more time here. The heel is
inflammation in the tendon?
Yes.
Okay.
I'm in an awkward position. Working the heel is better when they're flipped over, but if I'm just doing just footwork, I'm probably just gonna have them face up the whole time, and then that way I'm just finding little compromises for me to work this area. So both of my hands are pressing into the heel, and I'm doing like a bilateral movement. I'm kind of doing a little circular movement too, because this is tendon, so like I can't. It's not going to feel like a belly of the muscle, but I am trying to use friction to warm up the tendons in a way. So small circular movements, but I'm also applying pressure. There's I'm not just resting on the surface, but I'm pushing in here. And I can follow that. I can follow that down through to the heel, but I also want to bring it up again and follow it to the back of the leg into the soleus, because that is where the tendon of the foot, the heel, is starting. Right, it is starting in the soleus area, and so I do want to follow it up to where it is starting on the body. I'm using a lot of like pressure kind of movements because I am also like exploring this. And as I was exploring this this region, the back of the calf, the soleus region with pressure, I was noticing that there is a lot of tension and a lot of twanginess. You feel that? Do you feel it?
No.
Did you find it?
Wow.
I was like, wow. This palpative touch is also creating therapeutic results too. Like it's a 2-for-1 deal that we're doing. And you heard him say that like my pressure is radiating sensation up and down. So like I'm really like when I'm getting in there, I'm talking to those mechanoreceptors. If I am just like lightly feeling, I'm talking to some mechanoreceptors, but not the deeper ones or the ones that are responsible for communicating with like the spinal cord and like really going up the brain chain. Can I even him out? So I do a little bit of traction because we love traction. Traction is talking to all of our joints. I can start down here. I'm finding where his shin bone is, and then I'm popping off of it so that my finger is right next to the shin bone, and then I'm going to muscle strip up until I get to the origin site of the tibialis anterior and the peroneal muscles. Once I get to the origin site, I'm going to come back down and I'm going to muscle strip again. This muscle strip is serving as a therapeutic intervention for these muscles, but also I'm palpating to see what is going on with him. Once I get to the origin site of these muscles again, I can hang out here statically just because a static hold, a little trigger point therapy hold is nice. And when I feel like a good amount of time has passed and the tissues have melted underneath me, I'm going to bring my thumb back, come back to the bottom of the leg, and I'm going to go down another degree. This time when I go down into this land, this is where I'm feeling the twangy guitar string muscles. So I'm just going to muscle strip up so that it warms up the tissue, but then I'm going to come back and I'm going to start cross fiber frictioning against the guitar string muscles, that tension that I was feeling. He's guarding, you can see him guard against me, but I'm going to do the intense work because it's not like an intense guard against me, so I'm just going to do it. And like, if I can get him used to it, like the guard will lessen down, so I'm just going to put him through it. I would not make that decision if someone had like my fibromyalgia or like lupus or some kind of like autoimmune disorder. But someone who's like an athlete or like this guy does a physically demanding job, I'm going to push him a little bit. Huh?
I said that's
I would 100% define massage therapy as physical. And then because it felt good to me, I was cross fiber frictioning, but I was leaning backwards, and leaning backwards was bringing my hand down the leg. So just a little body mechanic wise, please like work with your body, not just your hands, because your hands can get so tired. So I'm cross fiber frictioning. I'm just twanging off the muscles that are super tight in the lateral part of the leg. Once I get down to the ankles, I am going to do some more bilateral movements in his Achilles tendon area. I'm kind of doing some static holds, so I could just hang out for a couple seconds and then I can move down a degree, statically hold it for a couple seconds, and then move down a degree, statically hold it for a couple seconds. And I'm going to follow the ankle and then follow where the stirrups attach into the foot. I'm going to statically hold the stirrups. I'm going to put pressure into where the stirrups are attaching into the foot for, I don't know, 20 seconds, 30 seconds. I don't know. Whatever feels good to my soul, and my ancestors start whispering, enough is enough. I always follow the line, even though I don't really believe in it. I follow the digestive line anyway. So because now I'm on this foot, it has to start up here. I'm going to press into this backward C now that I'm creating. I'm also holding his toes for emotional support. And then once I get to where the heel is meeting the arch of the foot, I'm just going to kind of statically hold this because it is a spot, especially if people are suffering from plantar fasciitis. this is a spot that they're going to complain about. And then I can do some more pressure points inside the heel where like the pelvis or reproductive stuff is. This, we didn't talk about it, but this whoosh is the spine. I don't know why it wasn't on the map before. This is like lumbar part of your spine. This is thoracic part of your spine. This is like cervical part of your spine. This is your skull. It's the lateral side of the foot is the correlation. So I like to just kind of like pressure point into the lateral side of the foot to kind of talk to the spine if that actually is like whatever. I don't know. I push into the middle parts right where before the toe bed starts because that's the solar plexus. So I'm going to press into him, one hand, two hands. I'm using one hand because I like to conserve the energy of my second hand. But after holding into the solar plexus for a couple seconds, I might take it up a notch and I might start stretching these toes so he can feel a nice stretch right in here where the toe bed is. And then I might bring my static pressure off to the side so that I can get a little bit more out of this stretch. And then I follow it up into the toe bed area, do some static pressure in here to talk to the lungs. And then I'm going to do a nice line of pressure right like where the toes are coming into the foot because that's what the sinus we're in. It's not up there anymore. And then I'm going to squeeze my toes. I squeeze this one. I'm talking to, what am I talking to? I don't remember. The adrenal. Oh, pituitary. Yeah. Pituitary gland up here. Thyroid and heart is over here. And then squeeze these, and these are the sinuses. I'm going to squeeze the
cervical spine.
This is the cervical spine.
Also right next to it is thyroid.
Yeah. So the side is the cervical spine, and then like in here, like a little bit, it is lateral, but like a little bit more on the foot, thyroid and heart, like in this little padding area. Squeeze these for sinuses. Squeeze the lateral side of the toes because we like wholesome strokes. Talk to the front of the foot as well. I can do some muscle stripping in here, in between the webbing, essentially. More inversion, eversion. I'm really squeezing. I'm Hulk squeezing with my hand, the whole heel because it feels great. And then I do it again. Or I don't do it again, but like I follow the path again to go back to the areas that I really felt that tension in. So if I felt that tension in this part of the leg, I'm going to go back there and cross so I friction this a little bit more and take up time. And then if they were complaining about whatever foot condition they were complaining about, I'm going to go to the muscles that correlate with that condition. So like plantar fasciitis, I'm going to hang out here where the stirrup muscles come in. I'm going to hang out in the arch of the foot, and I'm going to hang out right here where the arch of the foot muscles are kind of attaching in because the whole entire thing about plantar fasciitis is arch of feet. Yeah, Jada.
So now heel spurs.
So heel spurs, I don't know much, like off the dome of my head, I don't know much about heel spurs, but I do understand that we're struggling with this motion. So, and this motion correlates to this stirrups. So when we're having heel spur issues, I'm going to focus on what is doing this motion, this eversion and, this flexion and extension movement. What is doing that? So I'm going to focus on the stirrup muscles and their attachment sites right in here, which is going to bring me around the ankles and up here. So heel spurs, I am working very diligently in here because everything's going to be super tight and taut along here. And then once I've cleaned this up and I come back into the ankle, I'm going to work that ankle again because the tendons of this guy who's responsible for this, I'm going to work the ankles, get to the stirrups, and then I'm going to spend time on the heel. So they might be experiencing a lot of the pain in the heel, but I'm not going to spend all my time in the heel. I'm going to bring it up into the shins because the shins are where the muscles start that are responsible for this foot movement. So I start with the shins. I focus heavily on peroneals and tibialis anterior. I follow their paths. I focus on peroneals path around the ankle, and then I'm following in tibialis anterior's path over this area. It doesn't cross behind the ankle, but it comes over here, and I'll focus on him over here. And then I will get to the heel just to kind of like that placebo effect, essentially. Like they might not need most of the work in the heel, but I'm still going to touch it because they need to mentally know that I heard them when they said, ouch, my heel hurts. Right.
So let's say back pain, but it could be like their hip or their...
Basically, yeah. And if you don't touch their back, they're going to think you gave them the worst massage ever, even though you probably gave them the best session ever, but you didn't touch where they said ouch. And if you don't touch where they said ouch, they're going to get very disconnected from the session and think that you didn't listen to them. And we don't want that kind of session. A little giving the client, even if we don't think that the stereotypical massage will work for that client, giving them the stereotypical idea that they have in their head will still do wonders for them because they believe it. And if they believe it, if you sharply or harshly change their belief system, you might get negatively involved in their healing or non-healing process at that point. As a therapist, you have to be careful what you say to clients because you can create a story in their head that they're going to believe. So you have to be careful. Like we all know we collectively should not diagnose our clients. But we can we're still toting a really fine line when we say, oh man, there's a lot of tension and tightness going on in your back. You need to work on that. Like that, even though we say those words a lot and we have that communication with clients, it can borderline on diagnosing a little bit, and that can change stories in their heads, and they're gonna or when professionals like personal physical therapists say don't work your lower back because it's going to aggravate your hips. They're going to come into all of their workout sessions being like, I can't work out my lower back. My physical therapist said this thing to me, and now it's like a hardcore belief to them. So we have to be careful about the advice and the things that we say to clients. We'll get a lot, clients will say I'm the tightest person that you felt ever, right? And I never want to feed into it. I don't really want to give that. So I'll just be like, oh yeah, you're so tight. But I will not confirm, oh yes, you are the tightest person that I've ever worked on, because I don't want that story to become part of their personality, So I'll just be like, yeah, you're very tight, but we can work on it. It's definitely workable. Do we have questions, concerns, comments? How do your feet feel? How do your legs feel?
I did have clients who were asking for reflexology, and that's just in the work that them.
That's basically what I do too. That is essential. You do what you can. And I really do think that a lot of people don't really understand what they're asking when they say they want reflexology. I think they think it's just a foot massage. Many people don't really understand the reflexology map or the history behind reflexology or where it really came from. It just kind of became a fad a couple decades ago, and now it's a regular modality that people expect from us, but nobody gets it, nobody really understands it. I really do think that if you're focusing on the structures of the feet and the musculature in the feet, you will give therapeutic benefit to your client, which is going to make them feel good. So if you follow the reflexology map, or you follow the anatomical structure of the feet and you follow the muscles and the ligaments and all that stuff, you're still going to get to the same end result, right? So if you're not an expert in reflexology, it's okay. But I kind of do expect you to be somewhat of a expert in foot anatomy. I always when clients are leaving me when they have foot issues, I like to give them homework in balancing, especially one-legged balancing things, even if it's just stand up and just stand on one foot. Just standing here means that my feet are doing so much minuscule movements and work that it's training balance. So I don't have to do anything crazy. I don't have to go to the gym. I don't have to get special exercise equipment. All I have to do is just stand. And you could be doing this in the grocery line, right? You could be doing this while you're at work and you're just fit. Like, you can do this in various places and people aren't even realizing that you're training something. But balancing training is great for people with feet issues. Bosu balls are also really great. So if anybody comes to me with feet related things or shin related things, one of my biggest pieces of homework to them is work on your balance. Just stand on one foot, or get one of those boards that those wobbly boards, or a Bosu ball or anything like that will help with balance. And if you train balance, you're reinforcing it later in life when you're 50 years old and you really need it, like when it really matters and it's really important. So balance exercises, and I know the stereotypical homework that a lot of massage therapists give is like roll your foot on like a frozen water bottle, or like get like a tennis ball or golf ball and roll your foot on that, and like you can do all of those things. It's like foam rolling essentially. It's but I think self-administered soft tissue therapy is helpful and works, but I think they need to load the muscles after we work on the muscles. So not so much self-myofascial release, but more work it and load it. Balance exercise, toe yoga, like teach them like being able to just isolate your big toe and raise your big toe and isolate your toes. And see, I can't even do it. I can do it with my right foot more. So you should be able to isolate your toes and just lift your toes without your big toe. If people can't do that, encourage them to start playing with their feet and do that. Most people also can't like bend their toes. Do I have people can't do this. They can't scrunch their toes and pick stuff up. Yeah, so like that's another exercise that people can do. Have like throw a tissue or a napkin down or a piece of cloth or like a pencil and get them to pick it up with their toes. People have lost this mobility with it. We should be able to do all of this stuff, but we can't because we've lost it. If you don't use it, you lose it, right? Telling people to roll their foot on golf balls, tennis balls, frozen water bottles, that's okay. But give them an exercise too, because that will help build that stamina for them. So toe yoga, balance exercises. Yes. Cool. I think we can, we'll call it a day. We'll say goodbye to the foot and ankle. And next month when we reconvene again, we're going to deep dive into the hip a little bit more, a whole lot more. I hope this was helpful. And thanks for coming, guys. I appreciate y'all. Thank you.